Hello and good morning, everyone. Happy Friday. We are here to give you updates related to COVID-19 that relate to SEBB. My name is Sarah Story. I am the newest benefit marketing rep on the team. And I want to really thank you for participating in today's webinar. A few housekeeping items. All attendees will be muted. Please do not unmute yourself if the program does allow you to. We cannot assist with technical issues and apologize if they keep you from participating. This webinar will be recorded and posted for future reference and for those that may be having technical issues. And it will be located on the BA website. As far as addressing questions during the webinar, we do ask that you please use the questions feature to send questions throughout the webinar. We will address questions throughout the presentation when appropriate, and at the end of the presentation as time does allow. Questions not answered during the webinar will be addressed the following week via either email, phone, or Fuse. We do ask that if you have employee-related questions or scenarios to please send those via Fuse. We will not be able to answer those today during the webinar. And for urgent matters, please call our outreach and training line at the 1-800-700-1555. With that being said, I'm going to go ahead and give everything over to Mr. Robert Blyden, who is going to be our presenter.
Good morning, everyone. Happy Friday, another great Friday, and hope everyone's staying safe and healthy at home. Also, I have my window open, so I'm getting that sunshine right into this room that I'm working out of. So today on this webinar, we're going to be talking about some of the updates that are related to COVID-19 when it comes to the SEBB program.
Hey, so Robert, really quick. Sorry to interrupt. I just want to make sure that all of our attendees can also see our presentation here and see us, or see the presentation. If you could go ahead and let us know in the questions feature before we get started so you're not missing any of the visuals. All right, looks like we are good to go. Just wanted to double check that. Thank you.
So I did mail out a copy of this presentation last night, making sure that we got those last minute people registering. So if you haven't gotten it, please check your email that you registered with. So some of the topics we're going to talk about today are the two SEBB resolutions that came out recently, and then eligibility updates when it comes to during the COVID-19. We're going to briefly talk about medical FSA and DCAP updates. And I'm going to introduce you to the Coronavirus Aid, Relief, and Economic Security Act, better known as CARES. And then we're going to briefly touch on disabled dependents, initial certification, and the recertification updates. And then we understand that some people are having problems while they're teleworking at home. So we're going to also talk about some of the appeals process. And again, as every webinar, we're going to provide you with resources so you can be successful in your position. So first, we're going to talk about the COVID-19 SEBB eligibility update that came out. That's that engrossed substitute Senate bill that came out, 6189. So a part of this bill talks about that school employees eligible for that employer contribution as of February 29th will maintain their eligibility during this state of emergency. So we're talking about those employees that were already eligible, that are enrolled in SEBB My Account and are receiving that employer contribution prior to February 29th will maintain their eligibility during the state of emergency, during any school closure or changes in school operation for the employee. While the school employee is quarantined or required to care for a family member that's quarantined, and to take care of a child when that child's school or daycare facility is closed, or when the regular child care provider is unable to provide those services. So just a quick reminder that those school employees that have already met that eligibility criteria will remain in SEBB benefits until the end of the school year, which is August 31st, unless that employment relationship has been terminated, which means either the employer terminated or the employee resigns. And this is the bill that came out, the Senate bill that came out here on the right. And you can click on the link to read some FAQ. questions that were answered in this bill. It's about 5 pages long, so you can click on this link down below. So we do have a lot of questions that we're still trying to find answers to. And I know people are frustrated, you want answers, and we're trying to get those answers. So if you have questions, please submit any questions. Maybe we didn't think of them through the questions feature, and we will get those addressed. So some of the questions that we're still trying to get answered are, how will the 2-year look-back rule work for employees who have been anticipated to work that 630 hours this year, but were unable due to the school closures? And then what, if any, impacts on newly hired employees after that February 29th date? And what about those employees that are eligible as of February 29th, but have not reached that 630 hours? What happens after the state of emergency ends? Do they lose coverage at that point? And again, we don't know the end date for the state of emergency yet. That could be in June, that could be in August, it could be next September. We're not sure right now. And as we find that information, we will share that information with you via Gov Deliveries as it becomes available to us. So let's talk about the 2 SEBB resolutions that came out, that SEBB 2020-07 and 08. So 07 talks about continuation coverage eligibility, and 08 talks about extending that enrollment timeline. So 2020-07 specifically addresses continuation coverage eligibility. And we know that continuation coverage, there's nothing that a BA needs to do. All that's handling through the employee straight to the healthcare authority. We handle all continuation coverage, but it's good to have that knowledge. So beginning February 29th, the maximum period of continuation coverage is extended until 2 months after the date the governor terminates the state of emergency, which we don't know that date right now. But whenever that date is, employees have an additional 2 months after that date to have their continuation coverage extended. And we're talking about those ones beginning February 29th. And 2020-08 talks about enrollment timelines. So beginning February 29th, any enrollment timelines established for continuation coverage subscribers will be extended an additional 30 days past the date the governor terminates the state of emergency. So whenever the governor decides that state of emergency end date, those employees will have an extended 30 days past that date to enroll into continuation coverage.
Hey, Robert, we do have a question in the queue.
Yeah.
There was a BA that asked, what if an employee went on approved leave without pay status due to medical leave? So as long as the employee was eligible for the employer contribution as of February 29th, they will maintain their eligibility. And it looks like that is all.
Okay.
Thank you.
So we do have some resources when it comes to continuation coverage for your employees. So there is that continuation coverage website that's on the HCA main webpage, hca.wa.gov. And this is what the page looks like. If you click on the bottom where it says continuation coverage, that'll bring them to the next page that looks like this. So on the right-hand side, you have SEBB continuation coverage. Click on that, and that'll provide them with all the information they need about continuation coverage. And you can call our 1-800 number for continuation coverage. This 1-800 number is only for those employees that are on continuation coverage and retirees, not for active employees. That's 1-800-200-1004. So let's talk about any updates when it comes to the medical FSA and the DCAP. So school employees can change their medical FSA elections if they experience an SOE event that allows this change, and this hasn't changed at all. So when it comes to DCAP, school employees can increase or decrease their DCAP annual election if their cost for dependent or elderly care has changed. And that cost change is what creates that special open enrollment event. Employees have no later than 60 days from the date of the cost change to submit the change form. So they can increase or decrease their DCAP annual election. So here's an example: daycare provider closes. So if an employee's daycare cost decreases, they can decrease their annual election, and they can only lower it to the amount that they have already contributed for this year. So let's say it's the beginning of the year, open enrollment, an employee elects to have their DCAP program. So they've elected to contribute a total of $1,200 throughout the year. COVID-19 happens, or their daycare provider closes, so they've only contributed up to $400 at this point. So they can decrease their annual election no lower than $400 to what they've contributed for this year. They can't go any lower than that. And reasons like this, maybe your daycare closed because of the COVID-19. Now you're working from home and you're able to take care of your kids. That could be a reason. So what if an employee's daycare cost increases? So they can increase their annual election. So a reason might be their daycare closed and now they have to look for another daycare that probably is more expensive than their original daycare that they had. So now they need to increase their annual election, and they can do that. So most of you all have already probably seen this SOE matrix, addendum 45-2A, and then item number 18, that is what you want to look at when you submit that special open enrollment event. And at the very end down here on the right-hand side of that SOE matrix, it tells you when it's effective. And one thing that does not apply during this COVID-19 is this part here where it says valid documents. Again, you're not able to go to the daycare to get any type of receipt or anything. So school employees must submit that SEBB change form and status form to their employer along with proof of the cost change. Again, because you cannot get that valid document, emails are acceptable proof of an SOE event describing the cost change. So if an employee sends you an email describing their increase or decrease, that's an acceptable proof for an SOE event. And we ask that all requests should be treated equally for all employees. And you can find that form on this link down below under naviabenefit.com, forms and documents, and it has all their forms on that.
Hey, Robert, we do have a question that I'd like to
Okay.
answer for everyone. Someone did ask, can an employee change their DCAP election if they are now working from home and keeping their child home, but the daycare is still open? And what proof will they need to submit to Navia for this change? So at this time, due to COVID, we are allowing for parents to go ahead and voluntarily take their child out of daycare due to working from home or other reasons. The proof is just like we said on the screen, we do just need that email, and that would be acceptable proof as for the SOE change. Thank you.
All right, so let's talk about this new law that was enacted. So the Coronavirus Aid, Relief, and Economic Security Act, better known as CARES. So this is a federal law that was passed on March 27th of 2020. It expands how employees can use their medical FSA and their health savings account. And again, in order to have a health savings account, you have to be enrolled in a high deductible health plan. And the link down below, if you wish, you can download this bill here and take a look at what it's all about. So the main impacts of the CARES Act on healthcare related benefits is, first of all, it removes the requirement to have a prescription for over-the-counter drugs in order to use your medical FSA or your HSA funds, such as cold medicine, antihistamines, antacid, anti-inflammatories, and other products. Employees will not be reimbursed if more than 3 identical products are purchased in one transaction. It also allows for employees to purchase menstrual care products such as pads, tampons, cups, similar products like that, which are medical FSA funds. And these are things that are permanently added to the list of medical expenses. So again, both of these changes are retroactive to January 1st with no expiration date. So these are permanent changes. So what about those employees enrolled in the high deductible health plan? Deductibles and coinsurance are waived for COVID-19 testing and treatment and telehealth services such as phone and video conference. The provision began March 27th of this year and it expires December 31st of next year. So for more questions and information, please contact the plan. And you can click on the link down below. This will take you to some frequently asked questions on the CARES Act. And this is posted on the naviabenefit.com website. So let's talk about those disabled dependents, initial certification and recertification updates. So there are extensions and exceptions to obtaining a physician certification. So first of all, HCA is allowing those exceptions and timeline extensions until the state of emergency ends for eligible school employees that are unable to obtain that physician certification for their disabled dependents during the state of emergency. And we're talking about those disabled dependents age 26 or older. So when it comes to initial certification, HCA is allowing a temporary extension of the deadline to submit the physician certification for an initial certification request for coverage for those disabled dependents. So this temporary extension will end 60 days after that state of emergency end date, which we don't know right now. So 60 days, whenever the governor says this is the end date for the state of emergency, they have 60 days after that date to submit their initial certification. So HCA after that will send employees a letter to complete the initial certification process. So these are instructions that you may want to pass along to your employees. So employees must provide a written attestation to HCA attesting, saying that this is their word, that they are unable to get their dependent physician to fill out and sign Section 3 of the Certification of a Child with a Disability form. So this form does have Section 3, which is for the physician to fill out. So that section will be blank for these attestation instructions. So in order to submit the following to HCA, you can do that through fax or mail. We're going to want to see that certification of a child with a disability form, except Section 3, and that's where the physician fills out and signs. That does not need to be completed. Please do not submit this form to your healthcare provider. We're also going to need a signed letter from the employee attesting that they're unable to obtain a physician signature. The child is dependent on you for support and ongoing care, and the child's disability occurred before the age of 26. So we're going to need that certification of a child with a disability form, leaving Section 3 blank, and we're also going to need a letter attesting to these 3 items down below. And all that will be faxed and mailed to the healthcare authority to this information right here. So what about the recertification during this COVID-19? So HCA mailed out letters last week to subscribers required to recertify. So recertification dates that fall between March 1st and the state of emergency end date, which we don't know right now, will be extended to the last day of the month of the dependent's birthday the following year. So we're talking 2021. So HCA and the medical plan will notify subscribers in 2021 to complete the recertification process. Here's an example. So this dependent's birthday is sometime in May. So the dependent certification expires at the end of May, which is May 31st. Their new recertification date will be May 31st of 2021. So that's their extension period right there, the following year. So what about that temporary coverage, extending that temporary coverage? So during the first annual open enrollment last fall, HCA extended a temporary enrollment for those disabled dependents based on the attestation from the SEBB organization or the BA. So HCA is granting a further extension due to this state of emergency that's going on. So HCA mailed letters to those subscribers last week. Dependents with a temporary extension period that expires between the dates of March 1st and the end of the state of emergency date will have until 60 days after the state of emergency date to complete their initial certification. HCA or the medical plan will notify those subscribers to complete their initial certification process once the state of emergency ends.
Hey, Robert, we do have a question that I'd like to answer for everyone. There's a BA that asked if an employee has a question about disabled dependents, can they contact HCA directly or do they need to go through the school district first? We do ask that employees use their BAs as their first point of contact, and then if the BA has questions to then reach out to HCA directly. So please have the employees ask you guys as the BAs first, and then if you need further guidance to go ahead and reach out to HCA. Thank you.
So let's talk about the appeals process. I know it's been kind of challenging since most everyone's working from home and it's hard to get these signatures and get information on the appeals form. So there is a temporary process change that's in place to address some of these challenges you all are going through while teleworking from home. So when SEBB receives that initial appeal from the employee, the BA is unable to enter a decision and sign the form electronically, the BA should provide their decision within that email when they reply back to that employee. If the employee decides to appeal the decision to the SEBB appeals unit, they should also include this email that they received from the BA. And they can also leave their social security number blank on this form. The SEBB appeals unit may reach out to the SEBB or the BA for additional information concerning the employee's appeal. And again, here's this link here for to understanding the appeals process. And we understand it is a challenge to complete section 4, 5 and sign section 6 as a SEBB organization. So again, you can reply with your response in that email to the employee, and that employee should also include that email when they submit their appeal. So employees should submit appeals to the healthcare authority by fax or mail. So you notice on the bottom it says, please do not submit your appeals through Fuse. We've been getting a lot of appeals through there, and we're not really sure if the appeals unit is looking at those. So we want to make sure those appeals get looked at. So we want to make sure that you either fax that or mail that. And there's the contact information, the fax number there, and the mailing address. Please do not submit those appeals through Fuse. So let's talk about some of the funding rate update. I'm sure you all might have had the letter that went out when it's concerning the funding rate. So beginning July 1st through August 31st, the monthly employer-based funding rate will change from $9.94 to what you're currently paying for eligible employees to $1,056 per employee per month, beginning July 1st. So you'll continue paying that $9.94. And again, this will affect your invoice, your monthly invoice that you'll be getting from the Healthcare Authority. You'll see the amount change come July 1st. So beginning September 1st, the employer's base rate will change from $1,056 and will drop down to $1,000 per employee per month. Employee contributions and the SEBB continuation coverage for COBRA and unpaid leave rates will remain the same until January of 2021. So this is what it's going to look like here. So the current funding rate is $9.94. July 1st, it'll increase to $1,056, and then in September, it'll decrease down to $1,000 per employee per month. Again, that employee contribution and the SEBB continuation coverage for COBRA and unpaid leave will remain the same until January of 2021. And you'll see these changes on your invoice beginning January 1st. So here's some information if you want to take a look at that rate letter. If you go to the VA website and you click on rates down at the bottom, it'll bring you to this next site here under rate letters. Click on that spring rate letter effective July 1st, and you'll be able to read that letter and what's entailed in it. So here's a resource here. There was a Gov delivery that was sent out on April 30th that has information about the new base funding rate effective July 1st and September 1st. So again, like I said, we always provide you with resources to make sure that you're successful in your position as a benefit administrator. So we do have the benefit administrator's website. And we also have our 1-800 number, 700-1555. So that's outreach and training. And you can always send us a fuse. But if you have something that needs immediate attention, we ask that you please use the 1-800 number to talk to one of our customer service reps. And we provided the SEBB board there that they have each month. And you're more than welcome to attend one of those SEBB board meetings each month. You can also go on this site here and download the materials for the SEBB board or previous boards that they've held. If you haven't signed up for Gov Delivery, maybe you're a new benefit administrator, you can do that on the benefit administrator's website under notices and updates. In the green box up there, just click on register for Gov Delivery and it'll take you through the process to insert your information there. And something new on the VA website, some of you all probably haven't seen, is under notice and updates, you can see the COVID-19 guidance. Click the arrow, you'll have the drop down of all the Gov deliveries that we've covered throughout this webinar are all listed here and the dates that they were sent out. So if there's something during this webinar that you want to read further about, disabled dependents or the CARES Act, DCAP, appeals process, you can click on these links down here and you can read further information about those topics. Here's an employee resource here on the HCA website. This is the home page here. You can click on school employees down here and it'll bring you to this site here. Your employees can click on information about coronavirus to obtain more information. And this is available to all employees. All right.
All right. All right, Robert, thank you for giving us such good information during this uncertain time related to the COVID. I did want to remind everyone about the upcoming webinars that we do have scheduled. May 29th, we'll be reviewing the SEBB eligibility worksheets C and D. So that's May 29th. June 12th, we'll be going over special open enrollment events. June 26th, the retirement accounting and billing webinar. July 31st, understanding error correction. August 14th, we'll be preparing for the upcoming school year. Reminder that all of these start at 10 o'clock, and you can go ahead and go to the BA website or follow the link below to go ahead and get registered for those. All right, we will now be addressing some questions. Let's see. There are lots of great questions that were submitted, so let me just weave through those.
And just a reminder for you all, after this webinar, you all will receive an email which includes a brief survey, and we would greatly appreciate your feedback on how we can improve our webinars with you all to give you the maximum information that you need for your position.
Definitely. And I also wanted to send out a reminder that it is not your responsibility as the BA to submit these appeals for employees to HCA. Essentially, it is the employee's responsibility to ensure that they are mailing, faxing, and getting those appeals forms into us. It is just your responsibility to go ahead and approve or deny and fill out your portion. So just wanted to touch base on that as well. We do have a question. Someone asked, what if someone never signed up for the DCAP but now finds a need for it? Can they sign up? As long as they have a valid special open enrollment event, then they would be able to sign up for a DCAP. If they do not have that SOE event occur, then they would have to wait until open enrollment to go ahead and get signed up for that. There was another question. What about changes to FSA? Yesterday, someone read that the IRS is allowing plans to modify the plan documents to allow employees to decrease their FSA amount. Say this is due to a planned elective surgery being canceled. Us at HCA, we are reviewing these new IRS allowances, and guidance is being developed. So keep an eye out for a GovDelivery message for guidance on that.
Well, Sarah, I hope we're getting good questions besides the ones that we're still waiting answers for, because I know we can't think of all the questions that the BAs are receiving in their situations that they're in. So maybe we can add some of their questions to our list and try to get some answers back.
Definitely,
and again,
yes.
We will respond to your questions via email or Fuse probably next week, like we always do.
Yes. So we have, going back to the disabled dependent, someone has an employee whose child turns 26 in July and is disabled. They asked, what will he need to do to keep the child on coverage until he can get him certified? Let's see. So the answer to that, the school employee will receive a letter in the mail within the next month with guidance on available options. Whether they want to enroll that dependent into COBRA, if they are disabled, they will provide guidance in that letter on the process to get that dependent certified.
A lot of good questions.
Yeah. And for that, they can also use the BA. You can also provide the employee with that disabled dependent form to kind of get a head start and get that process started. And then go ahead and fuse that over for more information, or you can also send it over. Someone did ask, when are the new 2021 rates available, meaning the employee contribution? This information will come out as part of the open enrollment this fall, and they would then be effective January 1st.
That's a good question.
Yeah, very good question.
And if you have specific questions or scenarios that pertains to your SEBB organizations, please send us a few. That way we could research that and get you the right answer.
Yeah, so it looks like those are all the questions that we'll be able to get answered verbally. Like I said, like we said, we will get around to getting your questions answered here in the next week. We'll reach out via email, phone, or fuse. So be on the lookout for those. We do appreciate all of you participating on this wonderful Friday and during these uncertain times. We hope that everyone is staying safe and healthy. We thank you for attending.
And we greatly appreciate your feedback when you receive this brief survey. So is that it for the questions?
That's everything.
Okay. Well, thank you all for participating again on another Friday with us on our SEBB webinars, and we hope to see you in 2 weeks on the next webinar.
Thank you, everyone. Have a great day.
Thank you, guys.